recognized for 5 minutes.
Mr. Speaker, like many members in the House, I spent a good part of August visiting those with people in the 19th Congressional District that sent me here. I had several coffees all across my district, and one of the things that they spoke loud and clear is that they're very concerned about the direction of their country. And as I listened to the President's speech and I listened to some of his advisors, they think these people are not Main Street America, that they are somehow disillusioned. Well, they are disillusioned. They're disillusioned with their government. They see their government bailing out banks. They see their government bailing out car companies. They see their government taking over every aspect of their life, and now wants to take over our health care. I wanted you to read just a few of what the people of the 19th Congressional District are saying. Janie from Lubbock, Texas, I'm employed, self-employed, and pay my taxes. I firmly believe we currently have too much government in our business, in our daily lives. Jennifer from Wolford, Texas, keep the government out of health care. Remind them of our broken systems, Social Security, Medicare, and Medicaid. We don't need another one. Bobby from Lubbock, I do not want the government to run my health care. America does not need any more debt. Rick from Lubbock asked this question: why can't the government cut back on spending like the rest of us have to? Nelda from Lubbock, my husband and I were born to very poor families. We were able to realize the American dream. I want this opportunity for future generations. Michael from Lubbock, reform is definitely necessary, but not the kind that has been proposed. James from Lubbock, read, understand, apply the Constitution. A novel idea, James. Mandy from Lubbock, we want to keep our great insurance that we pay premiums for. We don't want our tax dollars to fund another fiasco and become another Canada. Holly from Wolford, stop the spending. When I get deeply in debt, I stop buying, worked hard, paid for things slowly but surely. I'm out of debt now, and I don't ask anyone to print money for me or pay for me. John from Lubbock, promise us that you'll sign yourself and your family on the same plan that you're going to force upon us. Grace from Lubbock, I hope you've listened to the many people here in Lubbock who do not have health insurance and who cannot afford it. James from Lubbock, the U.S. Congress and the executive branch of the federal government in particular should limit their reach to what is allowed by our founding fathers' documents. Robert from Lubbock, we must stop this crazy deficit spending and borrowing. Marilyn from Lubbock, I hope that you will find a way to use the programs already available to cover all Americans. Rosalie from Lubbock, government is spending too much money. Back off. Larry from Lubbock, in the bill there is language limiting the growth of physician-owned hospitals. These hospitals are able to supply health care services more efficiently than other community-based larger hospitals. I'm against this bill. Sandra from Lubbock, we need to slow things down. People need to read all of the bill before doing any voting. Kayla from Lubbock, who attended with her grandmother, I'm 9 years old and I'm wondering why the heck you're spending my future. Thank you for listening. Ron from Lubbock, when my kids were in college, my friends called me the ATM. I don't know the president. I don't want to be his ATM either. George from Lubbock, as big government continues to expand, there is a commensurate loss of individual freedom accompanied by excessive spending and amassing of ridiculous deficits. Michelle from Lubbock, I'm a registered nurse in a local emergency room. I'm personally against the health care bill. How do we fix overcrowding ERs? ER nurses are working twice as hard, seeing twice as many patients compared to the past. And Jack from Lubbock, say no to the government health care and protect our borders. And Joel from Lubbock, please say no to all of this excessive spending. Some of it does not fit within our Constitution. Susan from Lubbock, I have been an RN for 34 years. I'm tired of seeing patients turned away due to lack of insurance. This takes such a toll on families and health care providers. And Mary Jo from Lubbock, please do all that you can to keep the health care in our hands and not the government. Mr. Speaker, Mr. President, these are not people that are off on some tangent. These are people that are concerned about their country. They're concerned that the government is taking over every aspect of their life. They're concerned that we're mortgaging the future of their children and their grandchildren. They're concerned that their personal liberties and freedoms are at risk. Mr. President, Madam Speaker, It's time to listen to the American people and quit giving speeches. I yield back my time.